We're very excited here at Nuance about the strategic relationship that we announced with IBM around the Watson technology for many reasons, but let me try to explain why we think this is such a breakthrough for healthcare. As many of you know, we have a challenge in the US where we have an older population, more people getting added to the insurance rolls, and less money to pay for all this. So we have a major challenge to improve the quality of care while we lower the costs. And in order to do that, you need a data infrastructure so you actually know what treatments are working and what are not working. And the problem we have right now, there's two. In healthcare, people get paid for delivering more services, prescribing more drugs, doing more x-rays, not for the quality of the care that they provide. So the government is trying to change that with the recent healthcare reform legislation and the High-Tech Act. But the challenge is all the data in healthcare is disparate. What a doctor says over here can be different from what a doctor says over here. Some is electronic, some is in paper, some is structured, some is unstructured. So the power of what IBM and Nuance are doing is combining leading technologies to try to help solve that data problem. So physicians or nurses or any caregiver can dictate the patient encounter in their own words using Nuance technology. With Nuance technology, we pull out the important information from that dictation, what problems they have, what medications they're on, what allergies they have, and then we use the Watson technology to help us mine all that data to really help us provide better care. Whether that's real time when you're in the doctor's office and the physician needs to look up information using Watson and Nuance technology, they can all do that automatically through voice to help them make the right treatment decision. Or after the fact, if you've got a big population of patients and you want to see what treatments have worked or not worked, you can use Watson technology and Nuance technology to provide a set of analytics across that whole data. None of this has been possible before without the combination of Nuance and IBM technology. What Nuance provides today is we're the leading provider of speech-enabled clinical documentation and communication solutions for healthcare. So with our technology, clinicians, doctors, nurses, or even patients can dictate information about how they're feeling, what the treatment is, et cetera. We turn that from voice into text. We also have technology called clinical language understanding that takes that dictated narrative, the encounter, and actually pulls out the relevant data that's important to extract from that interaction. What problems you have. My heart is hurting, I may have a heart problem, I'm on penicillin, I got an allergy to this. Those are the critical facts that you need. So Nuance technology does all of that today. By bringing Watson's technology in, imagine having every physician and nurse in the US use the Nuance technology, and then you have to mine that to answer questions. What treatments work for this type of disease? If I look at this patient population versus that, what's the right treatment decision, or how many cases of this congestive heart failure occurred after I did this? This is where Watson comes into play. So it allows us to produce this large amount of meaningful data with the Nuance technology, and then use Watson to mine that data to answer important questions. You've seen Watson in Jeopardy try to answer more traditional kind of consumer questions. Think of this as Watson for healthcare. What's the best treatment for patient X? Do I need to worry about this if the patient presents with this symptom? That's the power of Watson, and when you combine it with the Nuance technology, we create what we call a level of medical intelligence. You don't just have this data out there that you can't figure out what it means. Now you can actually figure out what it means and what to do about it. With the Nuance speech and clinical language technologies today, we help healthcare providers and payer deliver better care at lower costs because they can dictate the information. They don't have to pay people to type what's said. It gets translated into text. And then instead of hiring people to take the dictated information and manually review each note to find out what the critical information is, our clinical language understanding technology automatically by the computer extracts that and then can fill a database of that information. And then when you combine Watson, which has an amazing capability to search tons of data, whether it's structured in terms of fields like in a database, the meds, the allergies that they're on, or unstructured information, just the patient came in, they were a 55-year-old woman, they're complaining of chest pain, whether that's in a database in a hospital, information in a payer, a national repository, automatically look at all that information and pull out the critical relevant facts. So as you trying to answer the question about how do I provide better care for, say, diabetic patients, you don't have to manually pull all this information and look through all the charts. It's all automated with Watson. So the power of these two is really amazing. You bring the power of automation of the input from Nuance, the dictation and pulling the facts out, with the after-the-fact capabilities, search capabilities of Watson, and you marry those in, and you can really think of tremendous breakthrough applications for healthcare. And that's why Nuance and IBM have come together to really take Watson from the consumer space in jeopardy to apply it to healthcare, where there's really critical need to drive better patient care at lower costs. Nuance today, with all of our solutions, we have systems in roughly 50% of all hospitals in North America, and over half of all physicians in the US already use our speech solutions today. We produce over 250 million patient reports a year and over 9 billion lines of what's called medical transcription. So we already produce almost 50% of all the clinical documentation in the US. And as a result, we're saving the industry hundreds of millions of dollars in not having to pay people to manually type this. And now we're moving from turning that voice to text and saving the cost of transcription to pulling meaningful data out of that dictation, as I mentioned before. So using our clinical language understanding technology, not only do we now let the clinicians describe what happened with the patient and turn that into text, we automatically extract the relevant facts, the problems, the diagnosis, the medications, the allergies automatically out of this. So can you imagine the type of data mining and analytics you can do once you have all that structured data that's been pulled out of all these patient visits in the US. Now you bring in Watson, the ability to mine all of this data and answer important questions. How many patients are expected to get better with this treatment path versus this treatment path really explodes what we can do in healthcare. And if you remember what the big problem is that we've all seen in the news lately, our healthcare costs are exploding. We have the highest percentage of GDP of an industrialized country spent in the US on healthcare. We're adding more people to get covered by government insurance programs, and we don't have the money, and our healthcare quality as measured against other industrialized nations is not on the top percent. So here we have a problem for the country, which is more people, older people with more chronic diseases and less money to treat them. How are we going to solve that problem if we can't mine what's actually happening out in the real world to see what treatments actually work better than what other treatments and then focus on those? That's the power of Watson with the Nuance voice and speech and language technologies.